Haemostasis is a sequence of responses that are designed to stop bleeding when a blood vessel has been compromised by injury. The hemostatic response must be quick, localized to the region of damage, and carefully controlled in order to increase its effectiveness. In short, the function of hemostasis is to prevent excess blood loss while still maintaining normal blood flow throughout the rest of the body. Firstly, we have vascular spasm. This is where the smooth muscle in the blood vessel contracts or constricts, therefore decreasing the amount of blood that we lose when a blood vessel has been damaged from external injury. Vasoconstriction occurs in two ways, through nerve reflexes on the smooth muscle and endothelin, which is secreted from endothelial cells. When injury occurs, nitric oxide and prostacyclin decline, resulting in vasoconstriction. The next step is platelet plug formation. Platelets are packed with an array of chemicals, many of which aid in the blood clotting process. Now that there has been a decline in nitric oxide and prostacyclin, platelets will gravitate towards the site of injury. Additionally, there is a glue-like molecule called von Willebrand factor that can be found in the blood and endothelial cells. This provides the connection from the platelet to the site of the injury. Once the platelets have binded to this molecule, they become activated. This leads us to step 3. Activation and aggregation. Platelets begin to release the contents of their vesicles. Serotonin assists in vasoconstriction, ADP activates platelets and encourages aggregation, and CA2 is required for secondary hemostasis. The now activated platelets will then secrete thromboxane A2. Serotonin and thromboxane A2 play an instrumental role in causing and sustaining contractions of the smooth muscle, which decreases blood flow. The last process in this step is primarily controlled through the glycoprotein 2B3A receptor. After an activated platelet causes this receptor to change its characteristics, it allows it to bind to fibrinogen, forming the platelet plug. The process of clotting consists of several substances known as coagulation factors. Clotting is a complex process, consisting of a cascade of enzymatic reactions until a large amount of fibrin threads are formed. There are 3 stages to clotting. 2 pathways, the intrinsic and the extrinsic, which lead to the formation of prothrombinase. Prothrombinase converts prothrombin into the enzyme thrombin. Thrombin converts soluble fibrinogen into insoluble fibrin, forming the threads required for clotting. It is carefully controlled because if a blood clot forms too quickly, it can clot an undamaged vessel. And if coagulation takes too long to occur, it can result in a hemorrhage. There are several factors that can inhibit or promote blood clotting. In terms of promotion, normal clotting relies on having adequate levels of vitamin K. Although it is not directly involved in the clotting process, it is required for the activation of multiple different clotting factors. The clotting process is inhibited within a person if they are suffering from a series of disorders that cause the slow absorption of lipids. This then results in uncontrolled bleeding due to vitamin K deficiencies. This specifically relates to the aging population as they are at higher risk. There are natural anticoagulants within the body such as antithrombin and protein C, and the presence of anticoagulants prevents coagulation from occurring. However, most anticoagulants are delivered medicinally. Anticoagulant medications are known as blood thinners. Some examples of medication would be warfarin, enoxaparin, and fondaparinux. These medicines are used to combat elements such as deep vein thrombosis. Other factors that inhibit the blood clotting process include the production of prostaglandin or prostacyclin. This is produced by white blood cells and counteracts thromboxane A2. This affects the ability for activated platelets to adhere to the damaged surface of epithelial tissue. If there are no sufficient anticoagulation factors present in comparison to other clotting factors in the body, venous and arterial thrombosis can occur.